Good morning, everyone. My name is Eugene Ayub.
Yeah, good morning, everyone. My name is 𝐷𝐿.
I'll begin with a quote by Steve Hawking. Our future is a race between the growing power of technology and the wisdom which we use it.
Thank you, Njoki. For most people, AI is a buzzword.
So AI is just simply a computer system doing what humans do, probably even better.
AI evolution in healthcare is one of the major success stories in our time. Look at the aspect of, especially in healthcare, look at the aspect of 3D imaging for like pregnant mothers. Jaramogi Oginga Odinga used AI for some form of cancer diagnosis and whatnot. What are some of the ways that you feel that AI has embraced healthcare? I'll start with you, Eugene.
When you talk about healthcare, there's something we refer to as the continuum of care. This is healthcare right from when you step into a hospital right to the end. So there are various phases of it, including you need to be diagnosed, you need a practitioner so that they can get to look into the treatment. Also, on the phase of treatment, AI comes in various ways. AI is very much being utilized, and right now, that's why we are thankful that at least there's the coming in of the Digital Health Act, so that it can just provide a framework for this new space, so that we can be able to understand everything that is being done with respect to AI and healthcare.
When it comes to healthcare, as Eugene has put, there are normally phases or levels to receiving treatment. So with AI, particularly in the healthcare industry, all this will be fast-tracked simply because it is there to assist the medical practitioners, from the nurses to the doctors to the laboratory technicians, giving a more accurate and better treatment plans, so that at the end of the day, it is used as a way to make it more efficient to discharge their duties, being that of medical professions. That's all I could add at this moment.
AI is playing a very major role in terms of analyzing the biological data, identifying potential drug candidates, and also predicting the efficiency of those drugs. And also AI is really coming in handy. Of course, I've already mentioned about the chatbots, whereby you get to easily consult a healthcare professional and matters telehealth.
There was a report a while back that I saw by WHO, which was dubbed Ethics and Governance of Artificial Intelligence in Healthcare. And one of the things that it was talking about is ethics and governance for AI in healthcare. And the report emphasizes on putting ethics and human rights at the heart of AI designs. So what do you think are some of the setbacks of AI in healthcare?
When it comes to ethics, I've done quite a comprehensive series on linking the methods and on the probable ways to which ethics can be carried out. There are and will always be three types of persons. One, the alarmists. Two, the developers. And three, the end users. So when it comes to the medical field, there aren't so much negatives that I have come across, especially when it comes to treatment. At no one point will the AI system replace the doctor. It is merely going to be assistive in nature, simply because if the doctor misses a certain diagnosis or what they are trying to treat, they will simply consult. Three, the third category, which I believe the US has done a lot of assistive surgeries using artificial intelligence system, preferably the keyhole surgeries. The success rate is alarmingly high. It's at about 73.6%. If you look at John Hopkins Hospital, I believe during COVID, one severe patient who happened to be a Kenyan was diagnosed and was being treated using assistive technologies in the AI realm, all simply because the AI could not suffer the catastrophic effects of the coronavirus. When I look at in terms of ethics, now as a whole, one, it will depend on the avenue which we take, because the key approaches to ethical dilemmas will depend on which avenue we want to take. Two, it will depend on what the artificial intelligence system is being used for. And three, it will depend also on at what level is the artificial intelligence system engaged in that medical treatment.
Outlines 6 core principles to promote the ethical use of AI. It talks about protecting the autonomy, protecting human well-being, safety, and public interest, ensuring transparency, explainability, and intelligibility. It also talks about the principle of fostering responsibility and accountability. It talks about the principle of ensuring inclusiveness and equity. With these principles in mind, and being that you aforementioned the aspect of privacy by design and default when it comes to data protection, when it comes to AI, how can we use these principles to better approach or better build AI in terms of ethical approaches within the healthcare system?
Whenever someone refers to ethics and in relation to data which is fed, majority of the principles which are proffered when it comes to artificial intelligence and collecting information is downright to the fear. So one key aspect that I've been trying to explore in detail are in each and every one of these principles, what is the primary concern which everyone brings to the table? Currently, as an implication, I'd say one, privacy and data security is one aspect which I am not too certain whether we will be able to affect it, because one, in terms of privacy and data security, the main concern is the AI system will require to access vast amounts of data, patient data, which, according to some of the principles of data privacy or data protection, is limitation for purpose. So, in essence, if I was to make reference to maybe the GDPR, which has Article 6 on lawful of processing, and maybe Article 9 on processing for specific categories of personal data, including health data. If, as a strategy, we try to stick to data protection regulations, then I strongly believe that in terms of privacy and data, we won't have so much leniency as to how people are going to take over or feed the AI system with data. Secondly, I can say biasness and fairness. Currently, all AI systems are inherently biased. Let's be honest. You feed it with an algorithm, the algorithm will give you a long shot of whatever you want to attain, but it will by no way be accurate. I think in the long term, the strategy would be a regular data audit or information audit, because as much as we want to admit that the AI system will be devoid of human intervention, at no one point will you say that whatever node, whatever probability the AI system can come up with will be foreseeable to any human comprehension. We have to be aware if, for example, we are capable of seeing 6 times to the power of 10 of a probability, the presumption is that majority of AI systems will be able to see an infinite amount of strategies, which is alarming. But the moment, in terms of bias and fairness, we have a regular data audits, then I believe we have a working formula. I can give an example of, I believe it's the US, which had, in terms of good jurisdiction, they have something known as the Equal Credit Opportunity Act, specifically, I believe with the 700 section. It's very lengthy, which in particularly addresses this concern of regular data audits. Third one I'd say is transparency and accountability. Some of the principles put down to regulate AI, especially in terms of ethics, is mainly concerned with transparency. Think of any AI system as a black box. We have, and I believe this is in the data protection realm, sensitive personal data and personal data. And health information or health records are classified as sensitive personal data. It will be extremely complex as a concern to try and interpret whatever decision-making process the AI system is undergoing. And as a strategy, I believe the best policy would be try to promote transparency in making the algorithms. This is just evident in trying to ensure that whenever an AI system is fed or is put into a sandbox, it will expose and it will also be easy to account, because we are using controlled data at that point before it is given an opportunity to be released to the real world for proper now execution. Lastly, I'd say informed consent, patients are very hesitant when it comes to releasing their medical data, and it's classified as sensitive personal data. Each and every one of these principles aims to try and give the public a bit of ease when it comes to them relaying their information or their personal details out there, because no one person at any one point would want their sensitive information released up to the public simply because an AI system or has leaked data or an AI system has been intercepted. There is an act, I'm trying to remember, but I think I'll post it on my LinkedIn later, about where it gave very good redress on informed consent, especially when it came to anybody in the medical fraternity or any patient who's seeking medical help. I think that would be my approach.
Ms. Kamanda, she's asking, how will patient data be protected from these challenges and risks like cyber attacks? I'm assuming that the scope of the patient data, like this blood type, the weight, the gender, and whatnot, is data that will be used in these AI systems. Are they shielded from any risk of manipulation?
Right now, we do have, with the coming of the Digital Health Act, we do have the Digital Health Agency. Part of the function of the agency is also just to coordinate this health data and making sure there's the integrated comprehensive health information system. So part of their task will be also, they are being referred by the act as the custodian of the health data. So it will be part of their mandate to ensure that such data is protected and put necessary measures through regulations to ensure that all the systems or anything that is needed is put in place so that it can be able to prevent risks such as a cyber attack.
So AI is in its infancy stage, and its long-term implications are uncertain, and regardless of how advanced our healthcare technology is, and no matter how educated our doctors are or how digitally literate our patients become, without a robust and supportive regulatory framework, the progress can only go so far. So what are some of the regulations that can be applied to AI in healthcare?
Globally, currently, encryption is one of the techniques which is being used everywhere, especially to safeguard data, patient data. So there's something known as homomorphic encryption. It will allow the computation of encrypted data without decrypting it, meaning if and when you go to a hospital, you will not be referred to as Njoki or Quincy or Eugene. You will be given or assigned a specific number. That number will be used to identify you in such a system. However much at what any levels, there are barriers to entry as to find out who is the truly associated person with that particular encryption code. So that is one strategy that I'd challenge vis-a-vis strategy or possible solution, which I'd possibly like try to solve that particular issue. Another would be interoperability. A lot of artificial intelligence systems are not available to everyone. We have a simple classification of AI systems, and it will depend on the domain which it operates in. One of the things is, in terms of interoperability, is encouraging collaboration. We can't act in isolation, and artificial intelligence as a whole field or realm cannot act in isolation, devoid of data. However, how we classify that data and how we exchange that data really matters. You can have treaties, we can have laws which govern how we exchange data across platforms, which mostly will not be hosted. I believe my learned friend 𝐵𝐿𝐿 gave us quite an insight on the WorldCoin issue, especially when you look at policies regarding data transfer across different domains. Because as you all know, majority of web hosting services are not in Kenya, they are worldwide. And so the data that you feed that server will be stored outside the country. So implementing a law that regulates this will allow some form of patient exchange between different healthcare systems and providers. Thirdly, will be regulatory compliance. Currently at Johns Hopkins Hospital, they are trying to cure cancer using AI. So this is done through something known as a protein folding mechanism. This protein folding just simply means the more complex a cancerous cell is, the more research it needs to be done. If this research could be shortened down, instead of taking decades, it takes weeks or months, it means that that probable cancerous cell or carcinogenic cell can be targeted and a proper treatment method will be given. We have so many AI developers out here, but the moment we have controlled testings of all these AI applications before they enter the real world, It will encourage people to actually know what kind of risk they're getting into and how to measure, so that it ensures that the regulations alongside it will be involved, and in tandem, there will be patient safety and privacy. Lastly, let's not forget, we have the issue of cost implications. AI systems are not cheap. They are extremely expensive. These systems simply take too much data, take too much time to train, and all that requires money. My mitigating factor would be encourage collaboration for the cost of implementation. The EU, like an example is we have an executive order. And if you delve to the US executive order by President Joe Biden, you'll realize that it meant to streamline AI integration and address the financial challenges, share the financial burden, implementing into the AI healthcare industry. We could do joint investment infrastructure, R&D, and the development of AI technology. As a parting shot, stakeholders normally work on the following: developing and updating regulations. No one act or no one statute will always be the same, simply because there are many areas which always crop up. Data security measures must be there. Encryption, ensuring AI models are transparent, fair, and valid for clinical use. That is extremely important. Encourage collaboration between healthcare providers and technology companies. And then in terms of fostering ethical guidelines, I will always insist it will depend on the regulatory approach we are going to take, because it will guide us on whether we are going to be liberals and decide that everyone who comes with an AI project will give you the runabout and give you the funds to keep it out there. If we become prescriptive, we will either be extremely rigid and tell people, no, you can't do this because the risk is too great. We can also be comparative and use other jurisdictions. We can use the EU, we can use China, we can use Australia, we can use countries such as India, because India is a great mirror to show us how the AI healthcare industry has taken off.
What I need to insist is on education and training. Sensitization is a very big thing when it comes to AI, mostly for the health professionals, so that it can enhance the understanding of AI technology. What we envisage is that AI won't take over what the healthcare professionals are doing, but we envisage that the healthcare profession will still remain in control of what we refer to as the critical decision-making process throughout the usage of AI. Also, number two, it's on M&E, monitoring and evaluation. We need just to keep on monitoring how AI is applying in daily lives. If there are any positive or negative effects, the same is to be taken into consideration, and what are the steps and or mitigation measures that will be needed in terms of actualizing everything to do with AI. From where I sit, the passing of the Digital Health Act was part of ticking a box type of thing, in that of course, you see the current government of the day had already promised the implementation of UHC, and part of it to tick the box was having legislation back up the implementation of UHC in Kenya. So it was basically one of the acts that was quickly rushed, because the president and the current government of the day appreciated that technology plays a very major role, and it's part of the pillar when it comes to implementation of UHC. So part of it is they needed an act so that it can provide a framework that will be able to govern everything to do with digital health. And it shows right from the act that this is one of the acts that was quickly, because we get to see that basically the act has just come in to do, I can say, one, to establish that digital health agency. Number two, I can say the act basically just replicates the Data Protection Act. And the last thing it came to provide was on matters e-waste. The coming in of the act, I know the implementation of the same will take a bit of time, because one, I know even the people who will be required to steer the implementation of the act, they are yet to understand what really it's all about.
So to me, it is premature. It simply tries to cure something that is still at its infancy stage. It does not specifically address the integration of AI services. Let's be honest. They tried so well with the Digital Health Agency, which I believe pushed for governance mechanisms, oversight issues to deal with the regulatory responsibility of monitoring, evaluation, and compliance with ethical AI practices. However, it could use a bit of sprucing up. When it comes to matters of artificial intelligence, I will always insist, whenever you mention AI, do not forget Data Protection Act or GDPR. They are synonymous. So they could outline the principles, guidelines for ethical and responsible use of AI in diagnostics, treatment, planning, and health data management. Secondly, it could enhance data security and privacy for AI applications. I mean, this is sensitive personal data that not only on the surface refers to a person's current condition, but ought to be kept encrypted in some manner. A good example which I've seen currently when it comes to this whole aspect of data protection and enhanced security is, if you have a medical insurance, you have this application on our mobile phones called Smart Access. Uses your data, private data that could be used to identify you in order for you to access your sensitive personal data. So that is layering. The moment you have such a layering, it will enhance data security and privacy for all AI applications. Number 3 is promote capacity building for healthcare professionals. Any GPT system out there is general. It is not domain specific. So the moment we put an artificial intelligence system, maybe for the health providers, we need to train them on how to use them. I'll give you an example in real context, and I hope there are medical professions within the seminar. If you go to majority of hospitals, they used to have patient data charts, which are always attached at the end of every patient's bed. However, currently there are hospitals such as Kikuyu Level 5, which have integrated a digital patient chart. That is a form of artificial intelligence system, because it will not only store that information, but it can also suggest a possible treatment plan, which, upon the confirmation and authorization of a doctor, a qualified medical practitioner in this case, will be utilized after, and I mean after, them giving their opinion, because they are trained. So the moment you promote capacity building, it will mean that integration will be easier, because each and every medical practitioner will now say, okay, this hospital used it, it wasn't so bad, we just need to know how it works. Aside from addressing the challenge associated with AI-driven, it will ensure, one, transparency, interpretability, and accountability within AI-driven health. I mean, any profession, from lawyers to engineers to medical fraternity, we have professional regulatory bodies. Lawyers, Law Society of Kenya. For engineers and quantity surveyors, it's BORAC. For medical practitioners, it's the KMPDU. For nurses, we have National Council of Kenya and KMPDC, of which IUB is very much aware of these organizations. The moment you are registered in any of these organizations, you owe a higher duty of care to the public, meaning that whenever any data is fed into an AI system, these professionals have the duty of care to ensure that that data is interpreted to the best of their training and ability. Data is governed by Data Protection Act in Kenya. Let's start from there. Let me try to paint a picture. So in every system, there has to be rules. So in the data protection realm, there has to be a data governance or data protection act. Okay, sorry. So whenever you're transferring data, let me just summarize. Whenever you're transferring data, the laws have to mirror each other. 2, all the data that will be shared across borders won't be 100% what you have in current country. It has to be put in a format which is understandable to a particular standard. So for example, if you're taking data from Kenya to South Africa from a hospital of a similar level, they will not give every single data. They will give that specific information which is required for that patient to receive further medical treatment. Upon those considerations is now when that data will now be useful to them. If that data is in some violation, there are forms which will be signed, such as disclosure, which means that in any case, any of that information, it's like a disclosure. Any of that information is used outside the purpose of which it is intended, then it means that hospital will be held liable for that information. Also, the communication medium is equally important. Whenever you're doing web hosting, there are terms and conditions, right? So these terms and conditions somehow are one-sided, because you as the user, you're not really sure as to what extent the information that you are using or the hosting services that you're using will protect your information. You're not sure whether it will be sold off. So the only information as at now that I have when it comes to web hosting services is that this international regulatory body, FCC, the FCC currently puts a caveat when it comes to Amazon Web Hosting Services. I believe in France, and is it Croatia or one of the Nordic countries had an issue with web hosting services, simply because Amazon is subscriptive to the US method of data protection and artificial intelligence regulation. The European countries or the Nordic countries simply said that we do not trust you.
I'm sure, Kenneth, for the organization that we work with, you do have the SLAs with, let's say now, this AWS. So part of it, if you've not already amended or even added addendums to your agreement to include the data protection clause, so that it can be able to cover all the issues related to data protection during the course of engagement, you really need to put it across, and so that the other party can even probably give a warranty that in terms of their safeguards with respect to data protection, that should come in handy to be able to protect yourself on matters data protection with respect to the engagement that you have with the service provider. Thank you.
As AI continues to evolve, do you foresee any shifts in the roles of healthcare professionals and how they can prepare for these changes?
I'm sure there are some of the functions that may be rendered redundant when it comes to healthcare professionals. For instance, things that was done manually but now could be easily be done with a computer system, for sure that role is going away. So now what is being called for is the issue of you need to upskill and reskill as a healthcare profession. How do you go about it? You first have to be interested and accept that AI and technology in general, it's here. And it's here to stay, and it's here for the better outcome of the patient. So what you need to do, how do I ensure continuous professional development? You do it by engaging, signing up for training, signing up for even conferences where they speak about AI. So for healthcare professionals, it's an opportunity for them to go and see how they can well understand this concept of AI and how they can work in hand with this AI to ensure that at the end of it all, as you've said, the main objective is just to ensure that this patient who's come to me with an ailment gets treated. That's wherever way that it's used for that to happen, it's not really a big issue. So it's for you to think as a healthcare professional. You look into your processes. Probably it's a hospital that does have the processes on how they go about various things. So there's this issue of even the current government of the day and insisting that all state agencies, even including hospitals, they have to include business re-engineering into their processes, in that for the processes that were mostly being done manual, to think of better ways to come up to make sure that now this process can be re-engineered, in that there's efficiency in terms of time reduction, and you still get to achieve the objective of that process. So with respect to that, healthcare providers need to just ensure that they get the requisite trainings and just have that attitude to understand and to implement AI into their profession.
I see there's another question from Vince. So many university students are wary. After 4 to 6 years of studying, they're hesitant to learn a new skill. They just want to go to work and earn money. How do you encourage university students and fresh graduates to realize the importance of learning these AI skills?
There should be a change of curricula for the university students, in that there should be some aspects to do with technology. Also providing matters AI and machine learning, so that they can get to appreciate that that's where we are going, and the government of the day has no intention of going back. You just need to know how you need to upskill and reskill so that you set yourself apart from the rest. It's just an element of natural selection. If you don't want to buy into this thing, then you'll be left on your own.
The moment you embrace change, then the bitter pill won't be hard to swallow. Rather, it will be bearable, and you will soon find out that you will be able to enjoy the change that comes with it and the benefits that follow.
Well, so in terms of parting shot, what I can simply say is that we live in interesting times, and we see things we wouldn't have considered, like we wouldn't have considered technology getting into. It's now part of our daily lives. So in terms of us as professionals, I still want to insist on the issue of upskilling and reskilling. Don't just remain where you are. Get to integrate, get to appreciate first that technology is here to help us, and even with respect to the government having even passed the framework that are assisting us in terms of protection and issuing existing regulation with respect to tech and data protection. You need to take this bold step and increase your skills so that it can come in handy in terms of with respect to your profession. With respect to the health sector, I know it will be a revolutionary step in that we want to ensure, okay, what is the set target is that everyone gets the access of health. So it's really, really interesting to see how we are going to ensure that each and every one person gets to access health, both affordable and it being available to you whenever you want, right from the time you'd go for treatment.
In everything that you do, there's always change. Use your time well, especially to learn and build. No one skill is absolute. It is always evolving. We always have new developments. We always have information. However, be wary of how to sift through relevant and irrelevant information. It is crucial in order for you to learn how to know the truth and sift through the lies.
Jaramogi Oginga Odinga actually did a research on cancer. I don't know how far the research went, but you can also find some of this article based on this research in our company blog post. So yeah, so I'll just tell you a bit about South End. We're a managed IT firm. We deal in data protection, cybersecurity, and managed IT. So you can contact us for all of your data protection and cybersecurity needs. So thank you, everyone, and see you on the next one. Bye.